Now, I'm trying to address a lot of radiography ethics, and this is all around how radiography should be practiced adequately in the proper way. Do you understand? So, in radiography department, you deal with a lot of patients, different types of patients. So, there are some patients that, yeah, they are in their senses, they can be able to do a lot of things for themselves. While there are some patients that you have to help them on a lot. So a category of these patients could be known as a helpless patients. So we're now trying to look at how you should carry them and why they should always be brought on a stretcher, not people holding them or you trying to still make them walk, you know. So when a patient is unable to walk, to move independently because of their disease condition or a disability or injury, you always try to bring them on a stretcher or a bed. Do you understand? This rule is not just there. There are reasons to back up this rule. And one of the reasons is patient safety. So you don't want the patient to fall or get injured in the process. So it provides stable support for patients who are weak. It reduces strain on the healthcare staff who might otherwise attempt unsafe manual lifting. Okay? So let me say, if you leave this patient by yourself and the patient fractures a part of the body or they injure themselves, it's you that they'll blame. Do you understand? Comfort and dignity is, it minimizes pain. So you just pushing the patient and it's cool and there's no pain. So also allow the patient to remain in a familiar position without unnecessary handling. It preserves their dignity by avoiding all those awkward, unsafe methods. Clinical necessity, you say that some patients cannot sit or stand for imaging. So a stretcher or bed allows the image in a supine or semi-recumbent position. So some patients, when they bring them on a stretcher like this, they don't even take them to the radiology bed. They can just image you here like this. Do you understand? Because of your condition. So it ensures proper positioning for accurate diagnosis. So efficiency in workflow is, it's easier to move patient quickly between the wards. That's if you're using a stretcher. You can easily just move them quickly. Reduces delays in urgent cases. Allows staff to use mechanical aids, rather than manual effort. So radiographic quality is this. The stable positioning reduces motion artifacts. As the patient is in one place without moving, it makes you to actually have a better imaging. Okay. So enables use of portable radiographic equipment and facilitate imaging without disturbing, any medical device that has been put in place. So that's what we have for the reasons behind this.